Hi, this tutorial is on, it's kind of like a dovetail to the colonic question that somebody had in my last lecture. But I'm sitting in front of, this is a autographed poster from Cirque du Soleil La Nuba. I was privileged enough to be one of the house physicians for Cirque. I think it was around 2006, 2007, but for that year, for that 18 months that I was taking care of these guys, fantastic athletes. A lot of them were previous Olympians, and when, God forbid, they knew what they were doing because they did the same thing, same routine, same show 2 times a night for the entire year. So the performers knew exactly where they should be on cue. They knew exactly when they were going to be caught. They knew exactly when the trampolines would be coming in one direction and another direction. So their timing was impeccable because of regimented practice. Even if they got injured, which a couple of them did, the injury was, for being a drastic, some of them, there was one injury in particular, I can't talk about the injury, but there was one actor in particular who fell from a height of 30 feet. Broke a couple bones. For an average Joe, that would have been no work for the rest of your life. This person broke a backbone, broke an ankle, broke a neck, got back into performing within months. That's spectacular. And it's obviously because of a good living, previous Olympic level performance and muscle memory. But when that person that was used to the regimented activity in pretty decent health got injured, there was a time off, but because of the way they treated their bodies beforehand, before the injury, they immediately returned back to normal. What I wanted to do is to talk about how the colon works, and when the colon is mistreated, if it's regimented and if the rest of the body is healthy, the colon, the small intestine, the stomach should return back to normal function. When you have a mistreated digestive tract and the system, the whole body is off. Thyroid's off, anxiety's there, fatigue is there, poor sleep, nutritional abuse, bad diet, obesity. Well, you abuse that digestive tract anywhere along the line between imagine a tube. We'll just go ahead and use the tube, the mouth, the esophagus, the stomach, the small intestine, the colon, and the rectum. Now, if you just lengthen that tube to make it all straight, it comes out to about 36 feet. From the mouth, down the tube, all the way to the anus. Now, in that long tube, it's all muscle. Going back to what muscle looks like on a skeleton, most skeletal muscle has an insertion point and an origination point. 2 points. You insert here, you originate here. If you contract the muscle, it gets shorter. It pulls the 2 bones together, the 2 opposite ends together, like the bicep. Contracts like this and causes the arm to get shorter or come in. Well, imagine that long muscle fiber being put into a circle. And that's how the digestive tract is from mouth down to anus. It's a circular muscle, smooth muscle. So it doesn't really work like skeletal muscle, but it works like smooth muscle. So it's built to hold and sustain for a long amount of time and then let go. And if you think about it, skeletal muscle, it holds very powerful, but then it fatigues out and lets go fast. Smooth muscle, the digestive tract, imagine that imagine the long tube. If you have a circular muscle that's supposed to hold food, push it on down, hold food, push it on down, hold food, and keep on going. You can imagine that like a food bowl would be like a mouse going down a snake's gut. You see this bolus of food just pushed down continuously. Then if you divide the digestive tract into its functions, you have the esophagus in this first part, that's this. The esophagus in the first part, that's meant to just take food from the mouth down to the stomach, really fast. Most of us really quick. Some of us, and if you see my tutorial on reflux, some of us have a esophagus that works terribly and it pushes food back up. But anyway, so the esophagus pushes food down. It's fast muscle all the way down. And then it dumps it into the stomach. The stomach is different. It's circular muscle, but it's made to kind of churn. It's the only one that churns. It's the only one that allows movement back and forth because you have food mixed in with acid and you want it to churn back and forth. if you turn it back and forth, you'll actually mix the food and acid, and it'll emulsify, it'll break down into what looks like vomit. It's essentially vomit. The reason vomit is the consistency it is because when the stomach has enough, mixed the acid and the food together enough, and it's at a certain consistency, the pyloric sphincter opens up, and then the stomach dumps into the small intestine, the next part of the tube, the long tube. Again, that's 36 feet. So when it's the right consistency, it puts it into the small intestine. Small intestine has bile. Small intestine has digestive enzymes. The small intestine is very, very particular because it's where the food and the macronutrients like proteins, carbohydrates, fats, it's where you absorb them into the wall of the tube. And that's also where in the small intestine, with all the absorption, you also want an army of white blood cells, because some things you don't want absorbed. Some things you just want to pass on through and dump out. And that's where the army of white blood cells that lines the lining, the circular muscle, is very strong and very full. I think personally that the amount of white blood cells in the small intestine is really how we are able to fight infections in the chest and lung. Chest, lung, and sinuses, actually. Those are the entry points for infection as well. If the gut is working properly, then the white blood cells that line the small intestine are working and they're doing a great job. Your immune system should be doing a great job. When the lining is not doing a good job, when you have irritable bowel syndrome, usually you'll have asthma, you'll have sinus infections, you'll get sick a couple times a year when this doesn't work. So after the small intestine, with all its absorption, if it absorbs everything out of that solid food or a solid bolus of vomitous-like material, then all you have left is the residual part that goes into the colon, and the colon at the end is meant to hold, maybe take out a little mineral and a little water, and then dump when it's ready. So that's probably the biggest portion. It's allowed to stretch out and hold for a while. Some people who go once a week, which is not healthy. I don't care if you're used to it, it's not healthy. Even in Ayurvedic medicine, you're supposed to go on a routine basis and get rid of toxins. So I would like patients to go once a day. If they don't, then it's worth it to check a thyroid, but that's getting past our talk today. Again, the concept is to understand that this whole tube, 36 feet of tube, is all circular muscle. And circular muscle starts, has an impulse up here, and the impulse travels down. There's like an electric cord. It's called the vagus nerve. It starts up here, goes all the way down. So when you stimulate a nerve, it's like an electric cord. You send electricity down the cord. It goes one direction. Well, the vagus nerve, when it's stimulated and I start chewing up here, the vagus nerve sends down an impulse and says, squeeze, 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 digest with acid, squeeze, squeeze, absorb, squeeze, 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 and then dump. So that's the way it works. The problem is, in this powerful boa constrictor-like muscle, if it happens to run into an area that's irritated, well, it's going to actually force a lot of pressure back into the previously constricted area, and then that's going to spasm, so it's going to cause a back and forth spasm. The only place that can happen is the stomach, where it happens gently. If it happens anywhere else, the tube doesn't like that, and it causes spasm and cramping. It's almost like your insides get twisted, and that's the abdominal cramp that most people experience. So it can get to the point of mild cramps. It can get to the point of just having the feeling that you have to go to the bathroom and have a bowel movement. It can get to the point where you're feeling bloated. That tube is supposed to be about that tiny, and in some cases, when it's distended, you can have that tube turn into a tube like that big. Imagine 36 feet of a hose, suddenly a garden hose, turning into 36 feet of a fire engine hose. It won't fit and you'll feel bloated. And that's when the muscle just says, I give up, and it enlarges. That's called ileus. Usually happens in the lower portion, and it happens also when your vitamins are off or when you've been hit in the area, like post-surgical, but very painful. A lot of patients will go through ileus when they have irritation, when they have food allergies. That's why the bloated effect after you have certain foods, it's not because the food is increasing size. It's just because of the gas that starts to expand and the muscle relaxing. But it's painful. Anyway, there are a couple things that do help with getting movement back on track. Number one is to, like the athlete who's trained the muscle, is to keep up a really regular daily regime of eating the same time every day, watching and having good nutrient, trying to defecate the same time every day, and sleeping and exercise. If you do the same thing every single day, there's no question that sleep habit, muscle will be efficient, sleep will be efficient, and bowels will be efficient. Some of us push the envelope. We party on the weekend or we stay up late at night, especially with finals, so can't help that if it's only a couple times a month. But again, if you set regimented times for eating, if you keep your pattern of what you're eating proper, and you can always ask your registered dietitian as far as guidance, or your naturopath, what should I be eating if I have an allergy to certain foods. The idea is to get education and get some help. If you're not regimented, you're going to have a problem when you fall off the edge and have an infection or have a imbalance or disease present. Then that belly is going to really manifest. For the majority of the people that I see in this office, they already come in with irritable bowel syndrome, fatigue, fibromyalgia, thyroid disease, so they have a whole bunch of things already going on. It's sometimes hard to figure out which thing to take care of first, because you take care of one thing with a medicine, it screws up another thing. Take care of another thing, it screws up the first thing. So what I would do is usually give inspiration or give some help with making at least the sleep back to normal, and then getting nutrition back to normal. Sometimes if you expect a little bit of cramping, okay, then you don't get stressed out, because when you get stressed out, more cramping will occur because of the stress response. There are things like deglycerinated licorice, DGL, that helps with stomachs, and please see my reflux tutorial. There are things like digestive enzymes that help when you don't digest properly or have food allergies. Obviously, staying away and eliminating there are 7 big-time food groups that irritate a lot of people. I'll post them. You stay away from those. Wendy Kohatsu is a physician that talks at my fellowship, and she has the 7 deadly foods to avoid. I'll post them and you can take a look at them. And also, sometimes to get movement going again, ginger is important. Ginger helps with movement, helps with regularity. Finally, bulking agents. If you have problems with constipation, bulking agents like psyllium are important. Old-fashioned Metamucil. Just have to be careful it doesn't cause a problem with excessive bloating. All these things help, but it really helps to establish regimented time patterns of eating, regimented time patterns of sleep, regimented time patterns of exercise. In addition, we cannot regiment stress, so what we have to do is get used to stress by neutralizing it. If you cannot stop the stressors that are coming into your life, and again, you don't have to be stressed out and mad to be stressed. You can just be driving along one of the highways. 355 is a popular highway around my office. And if somebody cuts you off or if you get stuck in traffic, that's a stressor. You don't have to be angry, but sometimes that little anguish that you experience will send off hormones from the brain, and it affects the colon, the small intestine, the digestive tract altogether. So what we do is when we get exposed to those stressors, if we have the built-in mechanism of relaxation or turning on the relaxation response, it will keep the amount of good hormones equal to the amount of bad hormones, or the amount of parasympathetic equal to the amount of sympathetic. And there's 2 of the basic nervous reactions that occur in a human. Parasympathetic is great digestion, reproduction, rest. Sympathetic is fight or flight. Parasympathetic is meant to happen 3 times a day. Sympathetic is meant to happen once or twice a year as far as escaping and fleeing danger. It's not supposed to happen 8 hours a day, but unfortunately nowadays we have it happen. It's backwards, and that's why I think a lot of our systems are screwed up. Immune system, digestive system, respiratory system, nervous system. So hopefully this is giving you a little insight as far as what usually happens with cramping, how to sometimes beat it. And you can certainly take one of the pills that I give to turn off pain, but then you'll have side effects from the pills. There are other medicines that have been used to kind of calm down the spasm in circular muscle, but again, if you, those are, a Bentyl is an old-fashioned one, but if you, again, work just like thinking this is a muscle that has to be bathed, it has to be nurtured, it has to be put back into regimented timing, you shouldn't need to go on too many medicines. It can be usually resolved with just time and then fixing the nutrition and fixing everything else we talked about. Hopefully this helps.